Hi, I'm gonna try to tell you guys how to set up high flow because we're having approximately 1,000 kids with bronchiolitis right now. So this whole setup is available in CPAD in the supply room that's behind the Winnie the Pooh bathroom. Grab this whole thing. You have to figure out what size your child is and to figure out what is the right size cannula. All of the sizes are available in each of the baskets or in the extra blue bins in that storage room. You want the nasal cannula there's a document on department links that will tell you what kilogram to pick for which size. But the big thing is you don't want to include more than like 50 to 60% of the kids' nares when you put it on. All right, so you're gonna grab this thing, you're gonna drag it into the room because Peds Respiratory is stuck in the PICU and aren't gonna be there for 20 minutes. Step one, bring this guy. You need to hook it up, all right? So you want both oxygen and medical air as long as you have a blender, all right? And the blender is this one that has the big dial, all right? You're gonna plug these into the wall adapters. So you just sort of swirl them around a little bit and then shove them into the holes that are marked oxygen and air, all right? If you plug one in and it starts making a horrible screaming sound like the hopes and dreams of children, plug the other one in, all right? You have to complete the circuit before the screaming will stop. So now you have oxygen supply to your unit. You now need to get that oxygen into something that connects to the patient. So the next step is going to be making sure that you have a connection from your flow meter to the device, all right? But there's different flow meters and you pick one depending on how big your kid is, all right? So the average starting point for this is gonna be about 0.5 to 1 liter per minute per kilogram, all right? So the standard one goes to 15. We have flow meters that go to 15 liters in all of our rooms. So pick that one if your kid's like less than 20 or less than 10 kilos. That's then just regular plain old oxygen tubing that connects from here to this. If you haven't attached things to it, it works a little bit better. But it just plugs into the top of this tower thing that has two things on it that we don't necessarily need. So that goes here. And this thing is just the warmer. If you see this or it's making a funky noise at you, it just kind of works like a candle warmer. So you press this blue button and you slide it in and metal plate attaches to metal plate. And that's where the warming happens. Now you gotta get it to the patient's body, all right? So this should ideally already be set up for you, but you have this tubing, and this tubing is what plugs into the nasal cannula. So you'll know that you have the right Peds setup because it has these two little prongs that fit into the two little prongs in here. All right, so that's gonna go on your patient. And then the other thing that you need to make sure that's connected to get this to work is the temperature probe. Real talk, we don't really care if you have warm humidified air until respiratory gets down here, but you need both of these probes to be plugged in for you to get the airflow that you think you're getting. So if it's not attached and this is separate from it, you just are going to just pretend it's Sesame Street and you're gonna attach like colors and like shapes to each other. So blue goes into blue, plugs in on the side over here. Sometimes you have to wiggle it around to get the right orientation. Okay, that plugs in. This first blue piece that has a little triangle fits into this triangle piece here at the base where it meets the machine. That plugs in there. And then the most important one of all is gonna be this distal temperature probe. So it just follows down the tubing and it plugs in here. So there's one little hole here and you need to plug that in, or as you can imagine, if this is not plugged in, all of your high flow air is actually gonna leave your circuit there and your kid gets no benefit. So you need to make sure that that's plugged in. So you then have to put it on the kid's face. Or most of the time, I actually will put the cannula on the kid while it's not attached, so you have one less thing to worry about. Tips, please use your parents, all right? These kids are all gonna try to wriggle out of it and they're all gonna hate it. So put mom or dad or whoever on the bed, put a folded sheet down on top of them, put the kid down, and then swaddle them like you've never swaddled before. So very tight burritos. And then you're going to put these on the kid's face. They peel off like Band-Aids. There's two little pieces that come off and then it goes on the kid's face. Yes. So obviously Dr. Heinrich is a little bit bigger than your average neonate, but prongs go pointing upward, so you get the airflow into his nose, all right? And these little cheeky guys are gonna go right up there. You can then put the tube behind their face. Again, Dr. Heinrich, just a tiny bit bigger than our average neonate.
Tiny.
But, whoop, whoop, whoop. Oh, sorry, sir.
There we go.
There we go. Things you'll do to your program director. So you stick him on there, all right, and you tighten it up behind his head, okay? And then you're gonna wanna plug that. Is gonna go in the back, which will normally have a slightly more room than it does on Dr. Heinrich. Okay, perfect. Any questions? Things where people go wrong are forgetting to plug in this little piece so that you don't have it fully connected, or not picking the right flow meter. The other piece of equipment on here, if you have a kid that is just having increased work of breathing, but not hypoxic, this is your blender, all right? It goes from 21%, which is gonna be room air only, all the way up to 100%. If your kid is just working hard, but full term, satting great, you can keep them close to 21% FiO2. If your kid's hypoxic, start them at 100% FiO2 and titrate that down when your numbers improve. Perfect. If you're feeling really advanced, you can also do a neb through this machine. You can't do continuous, but you can give them a neb every couple minutes. Remember, for broncholytics, you're not going to do it with every patient, only if they have a history of wheezing, strong family history of asthma, or ATP. There's 3 different pieces that help you connect it's the normal aerogen setup that your nurses are used to. So it goes on the oxygen line. So this pulls off. You put that guy on there. You're going to put the reservoir for your aerogen. And this is where you plug your aerogen in. All the units or all the rooms usually have aerogen units that are gonna plug into here, which are like the power source of the air. The solution goes in here. It doesn't fit together. Also in your bin should also be a connector tube where you go from big piece to little piece. You wanna make sure that this setup goes underneath this, because this is sort of the wet side of the circuit and this is the dry side of the circuit. Speaking of wet, if you're going for super bonus points and you want this to be humidified, you just connect it to this sterile water. So there's this giant 2-liter bag of sterile water that's included. On the back of here, there's already this line that's gonna have a little plastic connector. You pop it off and it's got this little thing that you're used to spiking IV bags with. You pull this off, you're gonna shove it in there and it's gonna drip water down into this pan. And as soon as you turn it on, this right here acts as a heating surface. So the water that goes in there is gonna get warmed and humidified by the high flow. So warm humidified air. If you have any questions, call me. Thanks.